Our health matters. It shapes how we live, love, work, and plan our futures. Every day, we learn more about how human health is deeply connected to the health of our planet and to the actions of others around us. We are vulnerable, interdependent, and bound together across generations. In this conversation series, we speak with experts from around the world about these connections. This is an initiative of the Global Health Justice postdoctoral programme at Goethe University, Frankfurt. Welcome to Our Planet, Our Health.
Well, hello everyone, and welcome to Our Planet, Our Health. In these conversations, we explore how our health depends on the planet's health and on the behavior of other people, including individuals and governments on the other side of the world, even when we disagree, and we deeply disagree about values and priorities. Today's episode is about antimicrobial resistance, why it matters, and what it means in practice for justice, policy, and public engagement. I'm really glad to have with us today Tess Johnson, a senior researcher at the Ethos Center at the University of Oxford. His work focuses on the ethics of infectious disease and antimicrobial resistance. So thanks, Tess, for being here and participating and engaging with this initiative.
Thanks so much, Romina. It's a real pleasure to get to have this chat with you. I'm really looking forward to it.
Me too. Thanks again. Well, antimicrobial resistance happens when bacteria, viruses, and parasites stop responding to the medicines designed to kill them. When that happens, infections become harder and sometimes impossible to treat. While antimicrobial resistance is a natural process, it is accelerated by human activity. And today, antimicrobial resistance is a silent pandemic, contributing to millions of deaths worldwide and imposing enormous social and economic costs. And addressing antimicrobial resistance will require radical changes in many of our practices, from medicine to food production. Together, you with this team from the British Academy are exploring how the Just Transition framework could help to guide a fair pathway to address this challenge and to design effective responses to this problem. So my first question, what I would like to ask you first is, how does the idea of just transition help us to think about antimicrobial resistance? And what kind of changes this transition actually involve? And since these changes can be burdensome, who should we think, or how should we think about who should bear this cost and burdens, and if we should compensate this cost or not? Well, this could be my first question. It's a lot there, but yeah, I will be happy if I have some thoughts from your side on this.
Yeah, absolutely, Romina. For me, I think that an important place to start with this is thinking back historically to where just transitions came from, because it can tell us a lot about how it applies to the AMR case and how it can really guide our thinking about what's involved in a just transition against AMR, antimicrobial resistance. So the term just transition came about during the labour rights movements of the 1970s, and it was used in that context to talk about this idea of leaving no one behind. There were labourers, workers in polluting industries, and they were worried that their voices weren't being heard and that this shift toward a green economy was going to leave them without jobs or without income or without appropriate training or being devalued in some unjust or unfair way. And it's gained broader traction since then too. So we've seen it be applied more recently in the climate change context, and that's where we hear about it most these days. So moving out of that original just labour rights context, people talk about how can we make sure that as we transition to a net zero future, that we don't leave people behind, that we hear people's voices, that we compensate for harms that are done to them to make sure that everything is done fairly. So it's a little bit of an interesting idea to apply in a new context like antimicrobial resistance. But as you said, that's what we're trying to do as a group. And I think it's really important because climate change and antimicrobial resistance aren't necessarily similar all the time. AMR is often seen as a bit of a medical problem. An individual person can no longer get effective treatment when they go to a hospital with an infection or some other thing, like they can't get access to drugs that are needed to keep them safe during a surgery or something like that. But actually, it's also this really big, complex, systemic problem that is crossing different sectors. Like antibiotics are used in livestock production as well. Antibiotics are environmental pollutants. They end up in our rivers and waterways and in our soil through waste. And so I think that as a result, we're thinking about the future that we want to shift to. What would that look like? Could there be a future where we live sustainably with microbes and where it isn't like an us versus them battle? So I think that because we've been framing AMR in that way, and because it raises some similar questions about not having an us versus them, not having polluter versus environmentalist, not having microbe versus human, we need to be thinking about justice in that context. So the idea of a just transition makes sense. We know that we want to intervene in this area. We know that we need to answer hard questions, and the Just Transitions framework can help us to do that. It can help us to answer questions like, who is actually in the most need of antibiotics globally? How can we protect animals and think about their welfare whilst also reducing the use of antimicrobial drugs to protect their health during livestock production? How can we ensure food security if we want crop farmers to use fewer pesticides and fungicides on their crops? There are a lot of these interventions and policies in the AMR space as well as the climate space that really make us think about trade-offs between different people and their interests, and maybe even between humans and microbes or animals and the environment. Lots of complicated stuff going on. So we really do need to be thinking about justice.
And do you think that I can guess that some of these measures, policies or pathways as part of this transition involve coercive measures, right? Which are the challenges there, the specific challenges in this specific area of antimicrobial resistance, and which could be the relevant frameworks or ethical principles for applying here?
Yeah, that's a really good point. I mean, there are hard decisions to be made. And as you say, coercion, mandates, prohibitions, bans, restrictions, requirements, fines, penalties, all of this kind of thing is going to necessarily be a part of the steps that we need to take moving forward and transitioning to a different future with antimicrobial resistance. So stewardship, where we try to protect the existing stock of effective drugs, is really key in this space, and it often involves coercion because it can be hard to make individual people take a sacrifice upon themselves when that's necessary in order to protect other people, especially when those people might not even be alive yet. A lot of the problems that we're going to see with AMR are in the future. They're already occurring, certainly, but it's probably going to get worse. And so we need to think about how we can do more to ensure that people do take on those burdens when necessary. It's not always a trade-off. Some of the time, there's these co-benefits where, for instance, it's actually beneficial for a patient to not take too long a duration of antibiotic treatment, as well as that being beneficial for the public in terms of not risking making antimicrobial resistance worse. But yeah, you're right, a lot of it is going to be coercive. So I think what becomes really important there is that we do consider what the ethical justifications are for those coercive measures. So if there is a politician or a policymaker rather, and they're thinking about, I have these different interventions I can implement, or I'm looking at a national action plan, I'm thinking about strategies here. Some of them might be involving taxing people's use of antibiotics. They might be involving restricting the kinds of antibiotics that farmers can use in their livestock. They might be things like capping the number of prescriptions or the duration of antibiotic courses that physicians can prescribe. And in that case, it's really important that we think about, what is it that makes that choice of intervention or that policy okay? Because a lot of people have this presumption, I don't myself share it, but a lot of people have this presumption that any kind of an infringement on people's liberty and on their choices to go about and use antibiotics as they want to need justification. And any policymaker should be going about with justifications for the choices they're making. So we need to be thinking about, when do these ethical justifications apply? What kind of evidence do they rely on? And so some of the work that I've done recently has aimed to make that quite clear. I've written out a list of different ethical justifications or principles that can be used in this context and that can help us to evaluate a strategy. So if policymakers are considering capping the number of antibiotic prescriptions that a doctor can give out on a given day, then they might be thinking about, all right, well, what professional duties does that doctor have? And can I refer to the justification that, well, the doctor has an existing professional duty to protect population health and to consider their patients' needs and in the context of population health needs. And that means that they should be doing this thing. So it's okay, maybe according to the professional duty justification, for us to implement that kind of policy. Or you might consider a person who's going into a clinic and they've got a mild self-limiting infection. It's not going to affect their lives too much, but they ask for antibiotics. Maybe that person has an obligation not to ask for antibiotics in that context. That might be according to a principle that we call the duty of easy rescue. And that principle says that we all have obligations to help other people who are in danger of harm if it won't cost us too much. So if we have that obligation, and if it holds out in this context, if it's not going to cost me much to be sick for an extra couple of days, then maybe it's also okay for a government to put restrictions in place that might prevent my accessing antibiotics without a more serious condition. So there's a whole bunch of principles that I talk about that I won't go through here, but I think that it's just really important that we're evaluating these. And when do they apply and when do they not apply? How do we get evidence about whether it's going to actually cost someone much to forego antibiotics or not?
Thanks. This is really clear and useful. And I'm thinking, I guess that the context is also important, right? And as part of the context of the structure in which these policies are implemented, the past is also important. Because recently I read a case study about the implementation of a policy requiring the ID for buying antibiotics in a particular African context. And in that context, and because of some past injustices, there is a group who cannot currently access to have an ID. So the implementation of this policy that could be really useful and a well-justified pathway as part of this transition in one country could be in another context the reproduction of a past injustice. Do you have some thoughts on this, or how can we incorporate these considerations when we are thinking in which are the best policies for this context?
Yeah, I think that's a really good example. It just highlights how, you might have one country in which it's completely appropriate because it's easy for people to access national ID. There's perhaps a well-supported healthcare structure that can allow people access to GPs and thus to prescriptions. And so it makes it easy enough for people to access antibiotics if they need them. But in another setting, perhaps in the same country, perhaps in a different country, perhaps, as you say, for a particular group who for historical reasons may not have equal access to healthcare or ID that's needed to access healthcare, that can just be worsening the conditions that they're already experiencing. And often these things will really build on each other. And as you say, just create more injustice. There might be associated issues with not having ID, such as only having access to informal work, or not having access to housing or welfare support. And when you build on top of that, not being able to access antibiotics, it can put a lot of burdens on people who are already struggling. And I think that while it's really important to address AMR and we need to be taking action on the issue, it's important that we don't do that in ways that are threatening more harm and suffering for people who are already suffering.
What I would like to ask you next, it's related with the fact that a transition requires a lot from all of us, right? And also require transformative change that in the context of the climate transition has been defined like the kind of change that required to review our values. And you previously mentioned that this transition is also involving coercive measures. So in that context, engagement and the public participation and the legitimacy of these policies, measures, and transition planning is really important, right? It's key. And it's key like in the climate transition, for example. But it's also challenging. And it raises the question of how to connect these scientific complex issues and global and coordination problems with the public and with the everyday life. So in the context of this challenge, the challenge of public engagement with this kind of issues and problems. I was really happy to see and learn about your project, Plant Power. I think that is such a creative and accessible way to engage the people with the topic of antimicrobial resistance. And in fact, last year I visited the plant trial at the Botanic Garden in Oxford several times with my son. So it's a really good way to engage family too. So could you share with our audience what motivated you to develop this project and which are the impacts you can already see on this kind of a strategy?
Yeah, thanks, Ramita. I'm really glad that you and your son enjoyed it. I had a lot of fun developing it and getting feedback and working with the Oxford Botanic Garden to produce the trail. To take it back a step with your first question about what motivates that and why is it important, I think you're right. It's all connected. We've got questions that we face as ethicists, as scientists, as researchers in a whole bunch of areas about how should we be consulting the public and involving them in research. And I mean, I know that you're doing great work about developing methods that are including the public and including knowledge makers and knowledge holders of various kinds and diverse audiences as well, to really think about how we can make sure that the right voices are heard and there are formalized processes in research that can allow people to contribute and make sure that research is going in the right direction. Because research then hopefully informs policy and informs what happens on the ground. And at that stage too, I think it's really important for public trust and for political legitimacy, especially in democratic nations, that the public are involved and able to participate in that kind of decision making. So this is really key for a lot of different projects in different spaces that I'm involved in. And it's something that I think we have to continue working on and checking in on. We know that in contexts where the public aren't engaged, either in straight dissemination activities where you've got one-way communication between an authoritative body like an expert or a policymaker to the public, those efforts are really important. But we also know that it's important that it goes both ways. And so that has to happen, as I said, in the research space, but also in the policy space. And where people don't feel like their voices are heard, we can get issues to do with the implementation of some of these, especially coercive policies, because you can get non-compliance, and you can kind of have this issue where you have to push into more and more coercive territory, and harsher and harsher penalties to get people to comply. Whereas if we undertake engagement activities and build up public trust, it adds legitimacy to the policies that are implemented. And I think that's just really important for building public trust and building resilience to the next threat. And AMR is likely to be one of those threats in the future, that we really need that kind of social cohesion. So for me, that's part of the motivation of doing public engagement work. And, it's a few steps down the line, but I think both involving the public and representatives in research, but then also communicating research to them and getting them to think about their own opinions can allow that kind of in a feedback loop way too. So what the Plant Power Stop the Superbugs walking trail does is it takes people in an 8-fold leaflet style through the Oxford Botanic Garden, and it takes them to various points on the map, various parts of the gardens. Presumably, they'd be there anyway. They're there for a nice day out. It's aimed to be relatively appropriate for different age groups. So, for instance, there are aspects of the UK curriculum which are covered at high school level. And so I've made sure to include some of that content, but it's also relevant for adults and for younger high school students. So what I want to do with that is to take advantage of the fact that people are already there. They're probably interested in plants, or they're interested in looking at some nice flowers. And hey, maybe they would be interested in learning something at the same time. So they pick up the leaflet at the office, and then they walk through the garden to these different spaces. And there's both a little bit of learning happening about, say, how does a microbe evolve to become resistant to an antibiotic or an antimicrobial drug, and how is it that plants come to have antimicrobial properties? And how is it that people throughout history in different medical traditions have used these plants and thought about their interactions with microbes, perhaps more than we do today in in Western medicine? So there are a lot of questions and a lot of information that the trail gives, but it's also hoping to ask the opinions of people who go there. It should be something like a walking, learning, and giving opinions experience. We try to ask people through little question bubbles on the trail about what they think about how we can learn from history and how we should go about living in a society that's trying to solve this big problem, and whether they have any opinions on the ways that they should use antibiotics or not. So it's been a really positive experience. In terms of the impact, we started piloting the trail a couple of years ago now. After some researcher feedback, we worked it up. We worked with the garden. We trialed it for a year, and it got really good engagement. We had 5,000 people go through the garden in around that time and get through our leaflets. So we revamped it to make it work year round. And now people can go at any time of year to the Oxford Botanic Garden, pick up a leaflet, return it to the office at the end of their trail, and hopefully get learning and get thinking.
Yeah, this is a great initiative, and the impact is really, the outcome is really good. I am really surprised, and I think that this is a really good project for taking up to other cities, to other places, because everyone loves botanic gardens. And in addition, it's a really good way to engage community. But I'm thinking that it could be also a really good way to integrate native or indigenous knowledge, because they have traditional knowledge in the role of plants, and it could be a good project for replicating in other parts of the world. We are really happy with this project, and we are really interested in this project. So we are going to share the link of the project website in the post of this interview. And so thanks a lot for sharing your thoughts and your work. And I think that what really comes through this conversation is that addressing antimicrobial resistance and the transition that is taking place there, it's not just a technical or medical issue, but it's a social, ethical, and political one, and one that requires cooperation and also creativity. That is what is showed in your project, and also care. So thanks a lot for joining us for this conversation.
Thanks so much, Romina. It's been a real pleasure, and I'm just glad to get to chat with you about all of this.
Okay, thank you to our viewers for being part of this conversation, and join us next time on Our Planet, Our Health.